Tonight on Doctor's Diaries.
So tell me what happened today. You got in a car accident. Well, you had your seatbelt on? No? You really should wear those things, bud.
This is all from smoking. This is all resulting from cigarette smoking. It's a big operation, though. I don't want to downplay it.
It's a very tough illness in a lot of ways, both from a physical point of view, from an emotional point of view.
I have a CF, and what it is it's kind of like asthma, you know? It makes you cough a lot.
Two kids in the car, both of them together in the front seat, no seatbelt.
Just 30 minutes ago, 14-year-old Eddie Zielinski was in a car driven by his older sister when it skidded on a patch of ice, spinning out of control and into another car. The impact hurled Eddie clear out of his seat and into some serious trouble. Emergency room nurse Janet Bailey is the first to assess his injuries.
What's your name? Eddie? My name is Janet. Want to disconnect me over there? I'm going to be your nurse while you're here, Ed. So tell me what happened today. You got in a car accident. Where were you in the car, sweetie? Ed, can you hang that up for me? Well, you had your seatbelt on? No? You see a lot of young kids, they think they're, pretty invincible, and we all thought that. But it's important that they learn to put on their seatbelt when they get in that car. Everybody should.
Up as hard as you can towards yourself. As hard as you can. Good. Now curl the toes down. Excellent.
Ready? 1, 2, 3. All right, honey.
Take some slow, deep breaths, okay? And all this stuff has to come out. Eddie, any pain when we press?
No, don't shake,
yes or
honey.
No? Yes or no?
He's got a little swelling, a bump back here.
Still no pain?
Yeah.
Where's the
Right there.
So you don't remember the accident at all, huh? Are you Mom? Hi, I'm Janet.
Hi, Janet. My name is Donna.
Hi, Donna.
He was unconscious.
Okay.
Yes, he was.
What are we looking for in here, honey?
Doctors find 8 separate fractures in Eddie's pelvis.
Oh, see that? He needs 6 weeks worth of rest to his pelvis. And then from there, he'll need, if he needs physical therapy or to get himself walking and moving again. Poor kid. Got a long road ahead.
Eddie's mother prays her son's injuries aren't permanent. One of her worst fears, that Eddie may never walk again. Dr. Augustine Muscatello is no stranger to delivering bad news. Today, it's 69-year-old Alex Senna who's about to have his life changed in an instant.
Did you ever smoke a pipe when you were younger?
No.
Okay, what? Sorry. Okay, so basically, what did they tell you what you have?
No.
You have a tumor here. This
They
thing is
tell me.
yeah, this thing is a tumor, and it looks like it's going through the skin and also through the jawbone.
On the bone.
So it's pretty advanced. I don't feel anything in the neck,
Yeah.
but the only treatment for this, because it's invading the bone, is to remove the bone. You actually have to remove part of it, and you have to have it reconstructed at the same time, at the time of surgery.
Mm-hmm.
And it's a big operation.
Yeah.
I mean, the operation takes 8 hours or so, but it means
Knock
you have
you out.
It's general anesthesia.
Knock you out.
Yeah. He had a cancer, a tumor growing in the inside of his mouth that had perforated the skin of his chin. This is all from smoking. This is all resulting from cigarette smoking. And we do this reconstruction with the plastic surgeons. Dr. Niazi, I want you to see him so that you can talk to him. It's a big operation, though. I don't want to downplay it. You'll be in the hospital for at least 10 days, maybe longer. He's kind of a complacent individual. And even when we told him that he had what we suspected was a cancer, he basically took it in stride. And I'm not sure that he really understood the seriousness of it and the complexity of what we were proposing for him. But he took it as though, well, if this is what has to be done, then let's get it done. Now you got to stop smoking.
Yeah.
I mean, you have to. Don't just say yes.
My last pack.
When you finish what you have, throw. Don't buy any more.
No more. That's it.
Because that's what caused this problem.
Yeah.
It's very common in people that are cigar smokers and pipe smokers, because a major part of the tobacco, when it's smoked, tends to irritate the tongue and the front part of the mouth.
When doctors take out the cancerous growth on Alex's chin, they will have to remove part of his jawbone and reconstruct it with a bone from another part of his body.
We're going to get a bone either from your arm or from your hip or from your leg. It depends on Dr. Niazi where he thinks he can get it from.
You got no extra on the side.
No, you have to take it from your own body and give it back. You have to transfer from one part of your body to another.
Okay.
Patients like it better when their physician makes them feel comfortable, and you can be the greatest surgeon in the world, and your patient will get better. There's no question. But I think the patients won't have that same sense of comfort that they would if you were able to communicate with them a little bit more. If you let it go, I mean, it's a serious condition.
Yeah.
It's not going to go away on its own.
Yeah.
It's a cancer, and cancers don't go away.
No, I know.
Back in the emergency room, doctors transfer Eddie Zielinski to the pediatric intensive care unit, where they will begin treating his crushed pelvis.
I gave a report upstairs. I kind of let them know that you had to close the door. And they just have to clean the room. They move somebody out, so it may take a little while, but they gotta clean the room. All right, so that's all we're waiting for. All right.
He's a typical 14-year-old boy. He loves to ride his quad. He plays basketball. He's really a very, very good kid. He's a phenomenal boy, and I know he's going to be back to it very soon. I have no doubts.
Well, once you're into ER nursing, you get stuck into it. There is no real organization. It's a controlled chaos. Sometimes it amazes me. It's pretty wild. It's a great job, and I really enjoy it.
Doctors just finished putting Eddie into traction to realign his broken pelvis. The process put him in excruciating pain.
That's to hopefully pull the pelvic area back straight. Right now, as it is, it's up and twisted. So it actually looks like this. So now we're trying to pull it down and back into place.
2 weeks after the car accident, Eddie is in less pain, and he's already able to think about what he'd like to do after he leaves the hospital.
I like playing basketball. It's my sport I play. I play like football and everything like that. And then I like riding a four-wheeler, like all over the place and everything like that.
His prognosis, he's got a long road ahead of him. He's young, he'll do well, but pelvic fractures, that's what you stand on. It supports a lot of your weight, and it's going to take a lot of time for him to heal and physical therapy, but he should have been wearing a seatbelt.
Two days ago, Alex Senna was told he needed to have a cancerous growth removed. Now he's back at Westchester Medical Center to undergo a surgery that will change his life forever.
This is a pretty large lesion. It's been there a while, so the risk of it involving lymph nodes in the neck is probably 20 to 30% at a minimum, maybe even higher. So we have to remove the lymph nodes in the upper part of the neck to make sure there's no tumor there. We've got to get good margins around it to make sure we don't leave any tumor behind, and generally that means about 3/4 of an inch to 1.5 inches of normal tissue should be taken with the tissue that's involved with the tumor.
Doctors have to be extra careful during this already serious operation. Alex has other health problems which could complicate the surgery.
The gentleman has a cardiac history. He had coronary artery bypass surgery about 15, 16 years ago. He has atrial fibrillation, and all these intercurrent diseases make the surgery itself more stressful for him. So Rochelle, what we'll do is we'll do the trach first, and then we'll do the major prep after we get the trach in.
The operation could cause Alex's windpipe to swell. To prevent him from suffocating, Dr. Muscatello cuts a hole in his throat to insert a tracheotomy tube, which will enable him to breathe. With the tracheotomy tube in place, doctors begin the operation.
We're going to keep everything in continuity with the next specimen. Let's raise this flap up just a little bit more.
2 hours into the surgery, doctors start to remove the skin tissue surrounding the tumor, just in case the cancer is spread.
So the first step was to remove the tumor, and what we did was made incisions around the tumor on the chin so that we had a good margin of normal tissue around it, so that we didn't leave any tissue behind that contained tumor cells. And then from there we went into the mouth, came around the bone that was involved with the tumor, cut the bone, again leaving a ridge of normal bone around it so that we didn't leave any tumor behind.
Doctors have to take out part of Alex's jawbone. They'll screw a metal plate into the remaining jawbone, which will act as a frame and help shape the bones that the doctors will use to reconstruct his chin.
The tissue that we used came from the arm in the area of the wrist. We took a piece of bone, the muscle overlying the bone and the skin overlying that, and placed it in the mouth. And we were able to connect the bone with the existing jawbone that was left behind. So basically it took us a while, but what we've done is take out the lymph nodes, the submandibular salivary glands, two major glands that make saliva under the jawbone, and the skin involved with tumor and the underlying jawbone or mandible. His surgery went very smoothly. We had two teams working. I started with the removal of the tumor, and the reconstructive team was harvesting the graft after I started working, and then once the tumor was out, they came in and replaced the bone and the skin. And this went relatively smoothly. We had no problems during the surgery.
I found it out approximately 3 months ago that I need an operation.
Today, Dr. Satish Babu will repair Ludwig Grunhauser's damaged aorta. Ludwig has an aortic aneurysm right below his kidneys.
An aneurysm is essentially ballooning of the artery. If left untreated, the aneurysm can grow slowly and gradually, sometimes even rapidly, and eventually might rupture. If it bursts, of course, it's fatal. So the classic treatment for aneurysm is really doing a big operation where we go in, arrest the circulation to the lower half of the body, and then remove the whole thing and replace it with a synthetic material.
They checked me out and think I'm a good candidate for a stent.
This is the actual graft that is put into the patient.
Dr. Babu will slide the graft, also called the stent, into the damaged section of the artery, replacing the ballooned segment that could rupture at any time.
Generally, most patients who have had a visit to our office where we have explained the procedure in detail to them, when they know what to expect, it is very easy for them to be awake. In fact, they are anesthetized below the waist, so they have spinal or epidural anesthesia. They do not feel anything. Hence, it's easy for us to be talking to them since they're not feeling.
You doing all right?
How you doing, Mr. Ledwood?
I'm doing fine.
How you doing?
How are you? How you doing?
I'm doing fine.
This surgery is extremely risky. The smallest mistake while working on a main artery could prove fatal. But this procedure is much less risky than it used to be. Today, doctors are able to insert the stent by making only 2 small incisions near Ludwig's groin.
This is called the angiogram. You can look at this is, here is the arteries to the kidney, this is the aorta. One can see that the healthy aorta above the kidney. And below, as you come below the kidney, the aorta is becoming like a balloon. It's nicely seen here. In this picture, one can see like 2 balloons here. That is the aneurysm.
Mr. Grenshauser? Somebody we need to raise the table. Mr. Grenshauser? Maybe not. Hold on.
How are you doing?
Maybe not. Okay.
In a moment, I'm going to tell you to hold your breath, okay?
An ultrasound monitor helps doctors determine where to position the stent.
Grenzhauser, take a deep breath in, out.
Yeah.
Take a deep breath in, and hold it. Hold your breath, hold your breath, hold your breath.
Yeah.
You can breathe.
Yeah. Yeah.
Using a guide wire and detailed x-rays, doctors insert the stent into the aorta.
Okay. Now you have to rotate it to the right.
As we go along, we're going to cross the lens. It's going to cross the lens.
When the stent is in just the right position, it is expanded to its full size in the aorta.
Now you got to watch how it unfolds. You're going to unjacket it. It's opening up slowly. I don't open completely yet. Now we have to pull it down. See what we did, we partially unjacketed it now. We want to make sure now we position it just below the level of the renal arteries now. Do you appreciate that being unjacketed?
Now that the stent is in, doctors make sure there are no leaks.
How you doing, Mr. Grenzhauser?
That's a good response, though.
We're moving right along. We're almost done.
The final step in this procedure is to do an angiogram to make sure there is no leak around the graft. Because if there is, then we'll have to take care of it right away. Vascular surgery is a very complex type of field where all the operations are extremely delicate, complex, and has to be perfect.
Mr. Grenzhauser, how you doing?
How are you? How you doing?
I'm doing fine.
Confident that the stent is working properly, doctors send Ludwig to the recovery room.
Hi, Mr. Senna. Do you remember me? I'm Erin. I'm the speech pathologist. I worked with you a little bit yesterday. What Kathy and I want to do is we want to take you off the ventilator and put you on the trach collar so you're doing all the breathing on your own.
Alex Senna has not been able to speak since he had a growth removed from his chin 10 days ago.
Let's suction your mouth out for a second. Well, when I first saw Mr. Senna up on the floor, he had just been weaned from the ventilator and was on what was called a trach collar, where he's breathing in and out through the tube in his neck and getting oxygen around it. Because of the tracheostomy tube, he wasn't able to functionally communicate. Al, what I want to do is I want to put the purple valve on so that you can talk. What's the face for? Okay. I want you to do something for me first before we do that, okay? I want you to take a big breath in and I want you to say, ah. Ready? Well, that was a little overboard. That was good. This time I want you to say 1, 2, 3.
1, 2, 3.
All right. There's your voice. That was it. You didn't know? The passenger speaking valve is a little purple valve that not a lot of people know about. And what it is it's almost a cap. It looks like a cap. And you put it on the hub of the tracheostomy tube, and it has a little diaphragm inside. So when you breathe in, the diaphragm opens. When you exhale, it shuts, directing the air up through your vocal cords or your voice box so that you can talk. Let me hear you.
What?
What? Good afternoon.
Good afternoon.
Aww. How does it feel to talk?
About time.
It's about time? Aw, look at that. I want you to say some things for me, okay? You ready? I want you to say pop, 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 pop.
Pop, 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 pop.
Okay. Ta, 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 ta. He's a happy-go-lucky guy. He's just happy and wants to get out of here. He doesn't seem to really
be too consumed with the changes in his speech.
Now we're going to say something else. Buttercup, 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 buttercup.
Buttercup, 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 buttercup.
All right. Okay. Good.
He won't get a lot of motion back in his tongue. From my standpoint, his speech will not improve very much, nor will his swallowing.
All right. Give me a squeeze. I'll squeeze you. I'll be back tomorrow.
All right.
Kathy will be here. Your other girlfriend's around. You did great. You need anything before I go? Don't pull that. No, you can't have anything to eat yet. Tomorrow, after your swallowing test. Nope, you can't have anything to drink either. You can't smoke either. That's how you got the cancer.
If people ask me, why, how come you cough so much, I'll say, it's kind of, I have a CF, and what it is it's kind of like asthma. It makes you cough a lot.
13-year-old Eric Lagath and two of his siblings suffer from cystic fibrosis, a hereditary disorder that causes their lungs to fill up with a thick mucus, making it extremely difficult to breathe. Eric's here for a checkup with Dr. Jay Boyer, a pediatric lung specialist.
What's happening?
Nothing.
Nothing.
Not much, no.
And how's your cough?
Good.
Better?
Yeah, not as much. I haven't coughed as much in the morning.
The relationship with the cystic fibrosis families is a very unique relationship. A lot of these children you may follow from the time they're born until they're into adulthood. You often share in their good points and their bad days. All righty, I got to examine you now. I got to get that thing for your nose. Cystic fibrosis is a very tough illness. It's a very tough illness in a lot of ways, both from a physical point of view, both from an emotional point of view.
Even though Eric may look healthy now, the odds are not in his favor. Most Americans with cystic fibrosis are lucky if they live to be 30. Dr. Boyer's only hope is to slow down this fatal disease as it inevitably destroys Eric's ability to breathe.
Good, buddy. Good. I like that. You need to get a little definition. I don't see ribs anymore. Look at that. I'm impressed. Favorite part of my job is the day-to-day interaction, the meeting with the families, meeting with the patients, seeing that what you did made a difference in terms of helping somebody improve their quality of life, improving something, and just being there for having a little fun with that. Booger check. It's worse for me than it is for you. You don't realize that. But I gotta look at this garbage in there, Yeah, I know. Why? I know. Did you believe that? You go to school all these years just to look at, sputum and mucus?
He's a cool doctor. Number one, for the kids. He's great with the kids. And also for me. It was somebody that I could relate to. And, it wasn't, when we went to the office visit, it's not just all medical health stuff. I mean, we BS about other stuff. We talk about football and we joke around and everything. It's very relaxed.
How many people tell you they want you to spit? Growing up, don't spit, don't spit, don't clear your nose. Even to this day, my father saying, get a handkerchief, what are you talking about? It's no one, I wish someone would give me permission to spit as much as I want the whole way, right? It's like a kid's dream. Spit as much as you want.
I do.
We should give you a spittoon. I'm going to get you one of those brass spittoons one of these days. My time with Eric and his family go back pretty much to when I was a fellow, when I picked them up as patients during my fellowship, and I've established a very good good rapport with the family since then. And they, day in and day out, show a lot of perseverance, a lot of courage, a lot of guts, and they not always know that it's more of an inspiration to me to see them than it may be for them. I don't know if who gets more out of the visit, them or me. Huh? Put it there. All right, good girl, good girl. All righty, so we're done with we're done until the next go around.
Dr. Babu just finished repairing Ludwig Grunhauser's damaged artery.
We feel very happy because there are so many steps where things can not go as we expect. So this went very smoothly, as you know. Mrs. Grindhauser, how are you? I was just looking for you here outside the... All right, everything went well. So it went as we expected. As you know, his aneurysm was pretty big and a lot of angulation, but went well. Dr. Mateo and myself, we both did it, and it went. So we hope he should do well, and if he really looks good, he may go home, you know, most likely the day after tomorrow.
And then when he comes back up, he's going to...
Yeah.
5 hours after the operation, Ludwig's daughter comes to visit.
So he's eating, he's standing up and everything, so give him a thumbs up sign for them. He didn't realize. He can't hear.
Thumbs up for them.
Very good. You feel all right? I will send him home on some antibiotics, just to be the safer side.
2 days later, Dr. Babu releases Ludwig from the hospital. He will need to come back on a regular basis to have the stent inspected.
Since he does not have any incision in the abdomen, there is nothing to prevent him from doing anything that he wants. So basically, there are no restrictions for any activity. He can go back and resume all his activities as usual. And that's what most of our patients are doing. So.
Okay. Take care.
Yeah.
Got it? Okay, fellas.
Can you feel the stick? Push your tongue out and touch the stick.
Alex Senna can't swallow solid foods. Erin McMurray is running a test to diagnose the problem.
Keep pushing it out, Al. Okay. Okay. Can you touch your tongue over here? No? How about over here? Okay. Try this. Back and forth. It's hard to do? Okay.
The results of the surgery left Mr. Senna with some problems with his speech and his swallowing.
He's looking like it's the torture chair.
Alex has to swallow a barium liquid during the x-ray. It will enable Erin to see how well he can control his throat muscles.
Al, we're just going to take x-ray pictures when you eat. That's all that's going to happen.
We can objectively see how the patient swallows. We get pictures of them eating and drinking and actually can see how they do, moving the muscles of their tongue and moving the muscles of their throat.
What are you forgetting to do? Talk.
Oh, yeah.
Oh, yeah. You forgot. So what we're going to do is we're going to watch to see where the food goes. The food is going to look dark, and we're going to see if it goes down to this white area, which is his airway, his trachea. Back here is his esophagus. So we don't want to see any of the food go down to this white space here, because that means he's going to aspirate. So, Al, open up your mouth for me. I'm going to squirt this in the back of your mouth. Okay, close your mouth. Swallow again, Al. Squirted the bolus back further in his mouth, and he was able to initiate one swallow. But this dark contrast here is all sitting in what's called the piriform sinus, and it's all residual. You can see a little bit starting to want to trickle towards his airway, which is this white area right there. Swallow again, Al. Try to dry swallow really hard. Okay, Pete. Joanne, I'm going to do 5 cc's of that again. A lot of it's clinging to the posterior pharyngeal wall in his NG tube. That he's doing well with. He's not aspirating it. Okay, stop. It's good. We're all done. We're done. Let me clean that up. We're just going to take an x-ray of you, okay? I'll be right back.
I don't like that.
I know you don't like that. I'm sorry.
Doctors tend to forget that communication is such an important thing to patients, and patients that have been on the ventilator or have had tracheostomies and haven't communicated for a long time, they just don't understand how huge that is. And then if I can give that back to someone, that makes me feel really good, and I know that I've made a difference for him, and he was as happy as could be being able to talk. So Al did okay. Al didn't do fantastic, but Al did okay. Al did okay enough to start eating non-thickened stuff, which will probably make him very happy.
Okay, take a picture
Want to take a picture of Flounder?
Yes.
Take a picture of Flounder.
He's shy.
Oh, he's shy, huh?
Eric Legath's pediatrician, Dr. Jay Boyer, isn't always home in time for dinner. But tonight, after a long day of treating chronically sick children, he relaxes with his wife, Marianne, and their two healthy children, Jose and Kayla.
You want some raviolis, Kayla?
A lot of times I become very appreciative for what I have. A lot of times you could get down, you can get upset about things, you have good days and you have bad days, and human nature is that you want to start feeling sorry for yourself. But all you need to do is walk through any hospital ward and see what some of these children are doing to get an appreciation and say that, hey, I got no reason to feel sorry for myself.
You want to go wrestle? Come on, let's go do a puzzle. Hey, are you supposed to be forcing that or eating it? No, wait a minute. You're supposed to be putting it on the cupcakes, aren't you? Hey, what are you doing? What are you doing? Wait a minute. That's not being very nice. You got to put that on the cupcakes. You're not going to have any left for the cupcakes. Oh, this is what makes it, coming home and getting laughs out of this helps release the stress in a lot of ways. I mentioned earlier, life is about attitude. You could have a negative attitude and walk around feeling sorry for yourself or why I was given this hand, or make the best of it. And it takes a lot more courage to make the best out of what you've been given than to just sit around and feel sorry. Anybody could lay around and feel sorry for themselves.
Eric has been the sicker of the children, or the more involved of the children.
These are my pancreas pills. They help digest the food.
In the Legath home, Eric begins a vigorous nightly routine. Thick mucus obstructs his pancreas, making it especially difficult to digest solid foods.
With meals, I usually take 10, and with snacks, I'll take about 5.
The treatment of cystic fibrosis centers around the control of the chronic recurrent inflammation and infection of the lungs. There's a chronic recurrent use of chest physical therapy to help get rid of a lot of that tenacious sputum, to help remove some of that tenacious sputum, to keep the airways as open and patent as possible.
To help his ongoing battle with cystic fibrosis, Eric also uses this nebulizer to control daily flare-ups.
This is actually Boomer Esiason. We met him at the Irvington High School. We had also met him one time before. Our Dr. Boyer took us down to see the Jets a couple years ago, and we saw Boomer Esiason there, and that was pretty cool too. Now I have to do my vest.
If Eric doesn't use this vest on a regular basis, a thick, sticky mucus will clog his respiratory system, making it difficult for him to breathe and too easy for bacteria to grow in his lungs.
It's a big vest with tubes that hook up to it. Where's the hole? Too small.
That's right.
Just make it a little bigger.
I see. And then when you press this button, it'll like shake. And it loosens the mucus.
You control it right there?
Yeah, right here. When you push it, it turns on. So I usually just sit on it.
Keep it on you for
Yeah.
And how long do you have to do it for?
I do it for half an hour. There's a little timer. I usually set it to half an hour.
Is that a little higher than that?
10.
That's only 10?
Yeah. Yeah, that hurts.
Does that hurt when it's so high?
A little bit. It squeezes tighter. After a couple minutes, I'll usually stop it and I'll take a cough. I'll cough it. I usually loosens it, so I start coughing a lot. and then I'll either spit it out or whatever, and I'll just turn it back on again.
You know, Eric hasn't really gone away for a weekend yet. So what happens when he goes away for like a real weekend or goes to camp or goes somewhere for a week and we're not there to really remind him that he's got to do therapy or take his pills or things like that. It's getting real close now. I'm constantly, Eric, did you do therapy? He's 13 years old and he's pretty good about it in the morning, you know, provided he gets up on time before he goes to school. So he's got to get up earlier because he's got to do therapy in the morning and he's got to do chest PT, but he's pretty good about it in the morning. It's afterwards he really should be coming home at school, you know, and doing it again, and that's where he really slips. And then at nighttime we just kind of remind him when he's watching TV, you know, probably around 8 or 9 o'clock to just start doing therapy and do chest PT. We haven't really given him information about, you know, what the mortality rate is, but I know he's read up and he's seen, you know, articles. It's not that I don't want him to know, I just don't want him to think that, you know, he's 13 and he's not going to be around, you know, by the age of 20 or so, you know, because we don't live that way here. We don't think about it that way at all.
All right, all done. Oh. Okay.
Do you feel like you're any different from the other kids in any way, or?
Just mainly taking the pills and doing the inhalers, nebulizer and vest and stuff like that. But in other words, just running makes me like worn out and makes me cough and stuff. And my friends, most of my friends know I have it, so it's like every day. Sometimes when I'm, let's say, running or trying to play a game, I'll get like out of breath or I'll start like, I'll cough and then it kind of feels like I have stuff in my throat, like mucus.
Sports have never been easy for Eric Legath, but he knows playing tennis strengthens his lungs, delaying the progression of cystic fibrosis.
So we strive for them to be involved and to do everything that any other child would want to do, and to not look at CF as a handicap where they can't do certain activities or they can't play in a team or something like that.
What's your lizard's name?
His name's Bullseye. It's a gecko, actually, a leopard gecko.
Eric was diagnosed with cystic fibrosis when he was almost 17 months old. Doctors then ran tests on his parents, only to find out they both carry the gene linked to the disease.
At the time Eric was diagnosed, we were actually trying to have another child because I wanted 3 or 4 kids. And, you know, the doctor said, well, you know, you may want to think about it. And they told us what the chances are. There's a 1 out of 4 chance that you will have a child with CF.
Knowing the odds, the Legaths still had 3 more children. Emily and Ryan have the deadly disease. Richard does not.
I just feel like he's got really lucky, but also good that he doesn't have it. So.
I guess that's a pretty fair answer. I mean, obviously you wouldn't want
him to have it, but still, he's really lucky.
Kids are perfectly healthy and get cancer. Kids are hit by cars. You know, there's so many different things that can affect your lives, you know. Nobody has any guarantees in my mind. There was no question in my mind. I mean, after we spoke to the doctor and they said, these are your chances or whatever, you know, we just knew we wanted more children. But other people had looked at us and said, you know, how could you bring another child into the world and everything, knowing that it may have this? Because I didn't have any testing. But I didn't want to know, because I knew I wanted more children, and I just felt that whatever was going to be, was going to be.
Get your drinks, guys, whatever you're going to have.
The decision to have children is becomes personal. There's no right or wrong answer to that. It's what each individual family wants and believes. It's not so much what my personal feelings are. I could give them the information that they seek about the cystic fibrosis, but it's really each individual family decision to have or to not have children.
When you tell people that you have 3 kids with CF and you explain actually what it is without just saying we have 3 kids with CF and the fact that there is really no cure for it, they do look at you and wonder, why you had that many kids, and that's fine, that's understandable. That's human nature, and I don't blame them for thinking that way, but I don't regret having them either. So, that's fine. It doesn't really bother us at all.
The Lagaths find their strength in one another. They don't dwell on the devastating reality that faces every single person with cystic fibrosis.
I'm not really sure if it gets worse as you get older. I think it might. That when, let's say I'm about 20 or something, I think it gets a little worse than it is. But as long as you keep doing what you're doing, I guess it doesn't, affect it that much.
Go for a walk.
All right.
Alex Senna has been in the hospital for almost 3 weeks. He's anxious to be on his own again.
The physical therapist and the occupational therapist all said you were doing wonderful, so you're going to be discharged probably tomorrow.
Yeah.
And then the speech therapist like me will come to your house and work on your swallowing and on your speech. Mm-hmm.
You come to my apartment?
Well, I'm not coming to your apartment, no.
Over the last week or so, he's shown a pretty dramatic improvement. I think it's because of the intensive attention that he was given by the medical doctors. That's why he's able to improve as well as he has so far. He has approximately a 60 to 70% chance of being free of cancer 5 years from now. And generally with this type of cancer, if they remain disease-free for 5 years, we consider them cured.
Dr. Muscatello really wanted you to start taking some solid foods, but I discussed with him that it was too hard for you with your tongue. I know you do. Hold this. Don't drink anything yet. Okay, go ahead.
What?
Go ahead and drink. You're doing a lot better with keeping your lips closed. And when you were upstairs, there's not as much leakage, and you're managing your saliva a whole lot better. That sounds great. Drink some more for me.
We're drunk. More.
I'm a little concerned about you keeping your weight on, because you need to put some weight on.
I know.
All these shakes that you're not drinking, that's your calories.
I know. I really do.
Because what's going to happen is if you don't eat and drink enough, they'll have to put a tube in your stomach.
That was a new one.
Okay.
I really, I think that was a new one.
Okay.
Okay.
You wouldn't fib to me, would you?
No.
Okay.